This was a great presentation of REFref. Oh my gosh, I'm having a little bit of trouble this morning. As a patient living with heart failure, sometimes we have good days, sometimes we have bad days. Today I am a little bit brain foggy, so if I go off topic a little bit, or if I'm a little bit slow, or my words don't come as quickly, this is why. Dr. Zeroth knows that there's days when I can be as sharp as any knife, but then there's days when I just am like a butter knife. So that's my reality. I want to thank the organizers first and foremost for making space at this most excellent conference. And not just for the patients to attend, but actually for our patient voices to be heard. And I have no disclosures. And first I'd like to just quickly comment on the presentations we heard here today. The four foundational therapies, I mean, we know they work. And it amazes me that in my Facebook community that I have about 1,500 women, that how many of them that have heart failure are not on GDMT. And when we talk about it and such, they say that often their cardiologists or their clinicians, their nurse practitioners, they haven't had the conversation with them. So through the group, we're empowering women to be able to actually ask the question and ask for the 4 pillars of therapy. So really, my message that I take away from that is that we really need to optimize and optimize quickly. And please speak with your patients about the option of being on the 4 pillars of therapy. Now, when it comes to Harriet, thank you very much for a great presentation, and the algorithms and such. It is still shocking to me that we have over 750,000 Canadians that are living with the high burden of heart failure. The economic pressure that puts on our system is immense. And it really saddens me that in a country such as Canada that is so incredible, that we seem to be leading when it comes to the population's percentage. It doesn't make any sense to me. So we really do need to do better. The preventive measures, that is something that as a country we really need to take on in so many different ways, not just for heart failure, but for preventative medicine, period. I'm going to use some of these big words all the time now, alarming, how little women seem to understand about heart disease being the #1 killer of women, and then of course with heart failure being sort of the leading to it, so leading from there. We need to beat these odds. We need to do better. 65% is not acceptable. Oh, sorry, I just have to take a deep breath here. My heart's racing. Dr. Zeroth. So again, I just want to add again that we need to make sure that we're prescribing the GMT therapies with your patients. And I really want to pause as well. When I saw the uptake for the rates and how low they are, what is going on? Like, we need to do a better job as patients to be able to step up and do that. So we as a Heart Life Foundation can certainly help in some way. I don't know what that is. Jillian, Mark, I'm not sure where you are, but yes, we can absolutely have to have a conversation around how do we increase patient uptake, because that is great that we can that you can ask them to take the GDMT, but if they're not taking it once they get home and sticking to the plan, we're still not there. Pregnancy. Candace, thank you very much for that great presentation. I was just at the Canadian Women's Heart Health Conference in Ottawa last week, and one of the comments that we talk around there is just how the lack of research that is done on women, and that is for various reasons, and 2/3 of research is done on men. We're improving those statistics now, which is great. Over the last decade, we've made some inroads. Women are not just small men. We know this now. Our cardiovascular system, as you all know, is the second different system within our bodies. And it's shocking that the first system, which is our reproductive system and our balance is there with hormones and everything, there's very little research. We just awarded a grant an award there to a trainee who was working on endometriosis. Did I say that right? I don't think I did, but that's okay. And it was surprising that had never been done. So the risk for pregnancy with heart failure, yes, but women still want to be able to have the option of having a child. So doing the therapies that we can, doing more research so that we can help these women continue to have a full life and have quality of life is very important. Now on to my debaters. I was really, when I was looking at this and I saw that this was going to be a debate on whether HEFref could be recoverable, And you know, I had cancer when I was 24, and I couldn't wait for the day when I had that word remission. Never thought that remission could be something that could be possible for me with heart failure, you know, but it is, and that's very exciting. Maybe, right? And as patients, one of the things that we talk about within the group and within the patient community is when you go see your cardiologist and you go to your appointments, how incredibly important that word stable is. You know, we talk a lot about recovery and improvements and everything else, but I know that when I first got diagnosed with heart disease, chemo-induced cardiomyopathy, Dr. Jazzle had said to me, he says, well, you know, a third get better. It's funny that we had thirds. Third get better, third get worse, third stay stable. And I'm going, I'll take stable. That wasn't my story, though, and 3 years later I slipped into heart failure, and Shelley got my docket, and I'm so grateful for that, because the care that I've had. So I've been living with heart failure now for 9 years, and I say that I am a living success story, because for 9 years I've stayed out of hospital. Other than to go into hospital for my CRTD, but that was a planned procedure. I've never had a critical event that has landed me there. And I know how fortunate I am for that. I'm also very fortunate because of the fact that I have access to care. I have a great heart function clinic that I can go to, and I have a great cardiologist, as we know. And so I'm very blessed, but not everybody has that option or can get the care in the timely fashion that they need. My story was rather uncomplicated. When I walked into Dr. Jazzle's office and he diagnosed me with chemo-induced cardiomyopathy, he told me I was right on time. The research was already there to support what I had experienced with the Red Devil drug and all the other chemotherapy medications, that 20 years later I was going to have this. So my last comment to you all out here is, so you realize that you guys are all, you guys out there are my hope. The research, the advancements in therapies, the medications, the updated evolving guidelines, and the meaningful patient engagement, these are the reason why I am here today as a success story, and why I want to remain being a success story. So I really want you all to help me to continue to be a success story tomorrow. And my last comment is, please keep pushing, keep questioning, keep being curious, keep caring, because while heart failure is part of my story, it doesn't, and if we have anything to say about it, it will not get to be my ending. As Heart Life states, and we should always remember, it is about life and not failure. So thank you.